Hi everyone, I am Dr. Ramprasad, your orthopedic specialist surgeon. In our orthopedic OPDs, we come across quite a lot of patients who come up with pain and stiffness of their shoulders. And scientifically, it is called adhesive capsulitis, and in layman language, it is called frozen shoulder. And the most common question posed by these patients to us is what are the types of injections we have for frozen shoulder treatment and which injection is best for me. So in this YouTube video, I would like to address these questions. Basically, for the frozen shoulder treatment, we have three types of injections. Before going into the intricacies, details of these types of injections and which one is the best, we need to know quite a few points about the stages of frozen shoulder, because the efficacy of the injection depends on the stage of presentation as well. First stage is the freezing stage. Here, the basic pathology is the capsule gets inflamed and it starts slowly contracting. So the patient presents with progressive increase in the pain and limitation of range of motion. Means he feels stiffness, and it usually lasts for the first 2 to 3 months. And the second stage is frozen stage. It usually lasts around 6 months. Means the timeline is around from 3 month time to 9 months time usually. And here what happens is the inflammation comes down, but the capsule remains contracted. So the pain for the patient comes down slowly, but his main complaint would be stiffness. He will not be able to rotate his shoulders or uplift his shoulder or do his daily activities. And the third stage is thawing stage. The timeline for this thawing stage usually comes after 9 to 12 months from the time of presentation. So if we look at the natural history of the frozen shoulder, usually it heals by 12 months even without treatment. So in the thawing stage, the inflammation comes down and the capsule slowly loosens up and gets distended and heals by itself, and the patient feels slowly increase in the range of motion and his stiffness comes down and his complaints will be almost 70 to 80% reduced, and he feels getting back to his normal activities. So if we look at the types of injections, the first injection, the most common one used by the physicians, is cortisone injection. 90% of the times it has good results and it works well in the first stage, that is the freezing stage, and 50% of the times also it works in the frozen stage, means the second stage. We do these cortisone injections in our clinic setting, mostly from the backside, but only downside of this cortisone injection doing from the backside, means posterior approach, is you might not know where exactly you are going. The point is you need to go into the shoulder joint for this injection, but when you approach the shoulder joint from the posterior approach, you don't know really the exact site of this injection. To circumvent this problem, we come up with the anterior approach. So from the front side, we do this cortisone injection using a X-ray guidance, means under the CM guidance in operation theater. So that gives more exact approach, and you know exactly where this cortisone injection is going, and you can assure the patient a much more better result. And the second injection is PRP, means platelet rich plasma. Scientific evidence is slowly building up on this platelet rich plasma for this frozen shoulders as well, and it has shown actually good results comparable to steroids and much better to steroids as well. But the only downside is we need to extract blood from the patient, and with a special equipment we need to extract the platelets and then inject into the shoulder joint in operation theater under CM guidance. And it has a very slow action compared to the cortisone injection, which really acts fast. Compared to the cortisone PRP, I think it's much more costlier, means it might be around 3 to 4 times the cost of a cortisone injection. The third injection is hydrodilation. This injection is a bit much more invasive compared to the cortisone and PRP injection. As its name suggests, hydrodilation means we dilate the capsule with slow distension by injection of saline. It is usually a daycare procedure. We take the patient into the OR, give him some sedation, and we dilate the capsule with normal saline under X-ray guidance, and After distinction of the capsule, it slowly gives away with a popping sound. Then we slowly manipulate the shoulder, and the range of motion comes back to normal for the patient. Usually we do hydrodilatations only in resistant cases where it didn't respond to cortisone or PRP, and it is mostly done in the frozen stage. That means the second stage, where pain is not really the bigger complaint. The biggest complaint is stiffness. So to summarize, the three types of injections are cortisone injection, PRP, and hydrodilatation. If the patient comes in the freezing stage, usually follow the cortisone injection or PRP. If the patient comes to us in frozen stage, we explain that cortisone injection might not work. So in these type of resistant cases or in the second stage, we usually go for hydrodilation, minor daycare procedure. I think by now you must have received some message regarding the types of injections for treatment of frozen shoulders, and your doubts must have been cleared. So thank you for watching our video. We'll meet in next video on another medical topic. Thank you.